Your healthcare just cost you $14,570 last year. That's right, every single American on average paid nearly $15,000 into a system that's consuming $4.9 trillion of our economy. And here's the kicker, according to research from multiple healthcare analysts. Up to 30% of that, nearly $1 trillion, is pure waste. Money that vanishes into a black hole of paperwork, hidden prices, and unnecessary tests. Let me tell you about Sarah. She's 34, works full-time, has 2 kids, and just got hit with a medical bill. That makes no sense whatsoever to her or her family. Her daughter broke her arm playing soccer last weekend after school. Simple fracture, quick emergency room visit, X-ray, cast done. The hospital charged her insurance $8,000 for that visit. But here's what Sarah didn't know at the time. That exact same procedure at an ambulatory surgery center nearby would have cost only $3,500 instead. According to recent data, outpatient hospital prices are running 55% higher than at these surgery centers for the exact same care. And Sarah's not alone in this situation at all. Right now, 20 million Americans are drowning in medical debt. That's 1 in 12 people owing more than $250. The total, at least $220 billion nationwide. But wait, the numbers get even worse than this. 1 in 3 adults in America, think about that statistic. 1 in 3 is skipping medical care because they can't afford it. And when people do go bankrupt because of medical bills, according to research published in the American Journal of Public Health, 60 to 66.5% of bankruptcies are medical-related. That's over 650,000 families every single year filing for bankruptcy because of healthcare costs alone. I talked to a viewer last week about her situation. She makes $65,000 a year, solid middle-class income. Her insurance premiums just went up again this year. Her deductible is $6,000 for medical care. And she told me, I'm paying for insurance I can't afford to use. The data confirms exactly what you're feeling right now. This system is completely broken and unsustainable. Here's what I found in my research that nobody's talking about. So where is all this money actually going? Let me break down the 3 invisible drains on your wallet. Drain number 1, the price tag you can't see. Imagine walking into a grocery store with no price tags anywhere. You fill your cart, get to checkout, then wait 3 weeks. And you get a bill for who knows what amount. That's exactly how American healthcare works today. According to federal data, the same medical procedure can cost 2 to 3 times more with commercial insurance versus what Medicare would pay for the exact same care. And here's the insane part about this entire situation. Since 2021, hospitals are legally required to post their prices online for 300 common procedures. So what's the compliance rate across the country right now? Only 29 to 55% of hospitals are actually doing it. This opacity, this price hiding, it's not an accident. When you can't compare prices, you can't shop around properly. And when you can't shop around, hospitals charge whatever they want. Drain number 2, administrative bloat in the system. Here at Macro Dynasty, we dug into the research. And what we found is absolutely staggering to see. Between 15 and 30% of every healthcare dollar in America goes to paperwork, not doctors or nurses, not medicine, just endless paperwork and bureaucracy. Let me put that in perspective for you clearly. According to multiple academic studies compiled in Health Affairs, administrative waste ranges from $265 billion to $935 billion every single year. The United States spends $1,055 per person on healthcare administration alone across the country. Germany spends only $306 per person. We're spending over 3 times as much just to push paper. And it's getting worse year after year. Data from Trillion Health shows that in 2023, hospitals spent $687 billion on administration, nearly twice what they spent on direct patient care, which was only $346 billion. Think about that number for a moment. For every dollar treating patients, they're spending $2 on billing codes, insurance negotiations, and compliance paperwork. Why is this happening across the entire system? Because we have a fragmented multi-payer system. Instead of one simple system, we've got thousands of insurance companies, each with different rules, different forms, and different approval processes. According to the Centers for Medicare and Medicaid Services, there are over 2,200 different quality metrics that providers have to track and report constantly. Drain number 3, defensive medicine. Here's something you probably didn't know about healthcare. Your doctor is ordering tests you don't actually need. Not because they're bad doctors at all, but because they're terrified of being sued. It's called defensive medicine in the industry. And according to research published in JAMA Internal Medicine, it's costing us between $46 billion and $300 billion every single year. Most estimates put it around $50 to $65 billion annually. A recent study found defensive medical orders averaged $226 per patient, representing 13% of total hospital medicine service costs nationwide. And here's the kicker from Harvard Medical School research. Defensive medicine actually works at reducing lawsuits for doctors, but it inflates your bills through unnecessary procedures. Procedures that do not improve your health outcomes at all. Wait, the connection gets even more disturbing than you think. All three of these problems feed each other continuously. Hidden prices make it impossible to challenge medical costs. Administrative bloat creates even more bureaucracy everywhere. Defensive medicine adds more tests to your treatment. And all of it gets buried in bills you can't understand. Paid by insurance companies negotiating in complete secret. Processed through administrative systems costing twice what they should. But here's what the data really shows about your wallet. Let's get personal about what this black hole costs you. Your insurance premiums are rising faster than ever. If you're one of 22 million Americans on ACA plans, I have bad news for you right now. The premium tax credits are expiring in 2025. According to policy analysis, your premiums could double. Your share of the economy is shrinking. Healthcare is now 18% of America's entire GDP. In 2023, we spent $4.9 trillion. By 2025, which is now projections, show $5.6 trillion. That's nearly 1 out of every $5 in our economy, vanishing into this healthcare system. Your paycheck takes a direct hit. Here's what that really means for average families. Administrative waste alone represents thousands of dollars yearly. Just the paperwork portion inflates your costs. Money that could have been in your pocket, instead paying someone to fill out endless forms. Your future looks even more expensive, and it's accelerating faster than expected. According to CMS projections from 2015 to 2025, healthcare spending expected to grow at 5.8% annually, eventually consuming 20.1% of GDP. Those projections are holding true today. If you're over 55 years old, you're part of the group accounting for 54% of spending, despite being only 31% of the population. And with baby boomers aging rapidly, Medicare enrollment hit 67 million in 2023. These costs are only going up from here. Your debt is rising too. Remember those 20 million Americans in medical debt. Research shows 41% of adults affected. For low-income people in poor health, that number jumps to 22%. And half of Americans are skipping medical care because of costs alone. That's not just a financial crisis. That's a health crisis waiting to explode. Want to know what you can actually do? Here's what the research shows next. All right, here at Macro Dynasty, we don't just show you problems. We give you tools to fight back. Here are 7 strategies you can use right now. Strategy number 1, become a price detective. Federal law says hospitals must post prices. Use it to your advantage. Before any non-emergency procedure, check the hospital price transparency page. Compare prices at ambulatory surgery centers nearby. Remember, they're often 55% cheaper. Look for cash prices too. Research shows cash prices lower in 47% of cases. Ask for an estimate in writing before any procedure. Don't accept will bill insurance and see. Strategy number 2, challenge everything. According to data, hospitals make billing mistakes constantly. When you get a bill, request an itemized statement immediately. Check every code and every charge carefully. Dispute errors immediately when you find them. Studies suggest billing errors are rampant. Don't pay until you understand every line item. Strategy number 3, negotiate directly. Here's a secret from the research. Hospitals would rather get paid something than get paid nothing at all. If you're facing a huge bill, offer to pay cash up front for a discount. Request a payment plan with 0 interest. Ask about financial assistance programs available. Most hospitals have them, but don't advertise. Strategy number 4, use HSAs strategically. If you have access to an HSA, max it out every year. It's triple tax advantaged. Use it for price shopping. When it's your money, you care more. Research shows HSAs encourage better price shopping. Strategy number 5, choose insurance wisely. During open enrollment season, don't just look at premiums alone. Calculate your total out-of-pocket costs. Check if your doctors are in network. Verify hospital price transparency in your network. Consider high-deductible plans with HSAs, especially if you're healthy. Strategy number 6, advocate for change. The research is very clear. Individual action is not enough. We need policy reform now. Support price transparency enforcement. Only 29 to 55% compliance isn't acceptable. Push for administrative simplification. That $265 billion savings could lower costs. Contact your representatives about transparency legislation. Passed by the House in 2023. Strategy number 7, build emergency reserves. The data shows medical emergencies are coming. Aim for $3,000 to $5,000 in a dedicated medical emergency fund, separate from your regular emergency fund. Even $500 can prevent debt spiraling. Look, here's the truth from research. You shouldn't need to become an economist just to get affordable healthcare. But until the system changes, knowledge is your best defense. Now here's what I found that gives hope. Research shows potential reforms save massive amounts. Electronic prior authorizations alone, $417 million. Harmonized quality reporting, $7 billion. Total administrative savings possible, $265 billion. Some experts push for single-payer systems to eliminate multi-payer administrative waste. Others want stronger transparency enforcement. AI could streamline administrative tasks. But here's what matters most. The data confirms what you're feeling. This isn't in your head. The system is broken, and it is draining your wallet. So here's what I want you to do. Drop a comment below. Tell me how this hit your wallet. What's your biggest medical bill story? Share it with Macro Dynasty community. We're tracking these numbers every week, and your experiences matter. So, hit the subscribe button right now to stay informed.